So we'll be looking at differences between types of anemia based on laboratory investigation. All right. So what is our focus for this lecture? Differences between type of anemia based on laboratory investigation. And this is you just looking at the different types of anemia, but you are trying to use laboratory test results to actually differentiate these anemias. Do you understand? So this is looking at the types of anemia. So let's define what is anemia before we go onto this table. And this table is where we'll be discussing the criteria we'll be using or the laboratory tests we'll be using against the types of anemia, right? How it will show up in this type of anemia and how it will show up in this type of anemia. So anemia is a problem of not having enough healthy red blood cells or hemoglobin to carry oxygen to the body's tissue. Okay, so hemoglobin is a protein found in red cells that carry oxygen from the lungs to all other organs in the body. Okay, so having anemia can cause tiredness, weakness, and shortness of breath. Okay, these are the most common um, characteristics or clinical presentation. So looking at the types of anemia, we have iron deficiency anemia, we have anemia of chronic disorders or chronic diseases, we have thalassemia traits, which is basically the beta globulins are not formed properly. Then we have sideroblastic anemia. Okay, so on this side we have different criteria that we can use in the laboratory to actually distinguish between different types of anemia. So for the mean corpuscular volume or mean corpuscular hemoglobin, for the iron deficiency, any arrow that goes down is actually decreased. Mean corpuscular volume will be decreased in iron deficiency anemia. It will be reduced, it will be decreased or normal, okay, in chronic disease, okay. So anywhere you see N is normal, okay. Anywhere you see the arrow going up is increased. Anywhere you see arrow going down is decreased, okay. So mean corpuscular volume will also be decreased in thalassemia traits. It will be decreased in congenital sideroblastic anemia or increased in acquired sideroblastic anemia. Serum iron will be decreased in iron deficiency. It will be decreased in iron of chronic disease. It will be normal in thalassemia. It will be increased in sideroblastic anemia. Total iron binding capacity will be what? Increased in iron deficiency. This is because iron is deficient, okay? So the receptors for binding iron will be free. Do you understand? So the total iron binding capacity will be increased in iron deficiency anemia. It will be reduced in anemia of chronic diseases. It will be normal in thalassemia. It will be normal in sideroblastic anemia. How about transferrin saturation? Transferrin saturation will be decreased in iron deficiency. It will be decreased in anemia of chronic disease. It will be normal in thalassemia traits, and it will be increased in sideroblastic anemia. Then serum ferritin will be decreased in iron deficiency anemia. It will be normal or increased in chronic diseases. It will be normal in thalassemia traits. It will be increased in sideroblastic anemia. Then serum transferrin receptors. Okay, so since iron is not binding, the receptors will be what? Increased. Okay, therefore chronic disorders, it will be normal. For thalassemia, it will be normal. For sideroblastic, it will be normal or increased. Then serum hepcidin will be decreased. Okay, in chronic diseases, the serum hepcidin will be increased. For thalassemia, the serum hepcidin will be normal. For sideroblastic anemia, the serum hepcidin will be decreased. Okay, then bone marrow iron stores. For iron deficiency, it will be what? Decreased. For chronic diseases, it will be normal or elevated. For thalassemias, it will be normal. And for sideroblastic anemia, it will be normal or elevated. Then erythroblast iron will be decreased for iron deficiency, it will be decreased for chronic diseases, were normal for thalassemia, and in sideroblastic, it will be in ring forms. All right. So, guys, these are the various ways we can use laboratory investigations to actually differentiate the different types of anemia that we have in hematology. Okay. So, I hope you guys enjoy this lecture. could just back this video and get to like screenshot this table, all right, because this table is actually the one that was approved from World Health Organization. So you could screenshot this table and keep it somewhere so that I can always memorize this table, right? So this is a lecture on differences between types of anemia based on laboratory investigations or laboratory tests. Okay, so bye for now.